This is a rotator cuff tear. The rotator cuff tissue above the shaver should be attached to the bone below the shaver. The first step is to prepare the repair site. This is done with a shaver. Any remaining tissue is removed and the surface is roughened. It is a fairly small tear, so a single anchor will be placed. A metal guide is positioned exactly where the anchor is desired and the socket is drilled. A soft all-suture anchor is placed down the guide on a metal inserter and deployed. There are 4 suture strands from this anchor. The first suture is retrieved and it is passed through the back of the tear using a suture passing device. That suture is then retrieved out another portal to keep it out of the way while each subsequent suture is passed. In this case, the process is repeated 3 more times until all 4 sutures are passed. Each suture is passed in front of the last, ensuring that there is good spread across the entire tear. Once each suture is passed, an awl is used to create a socket laterally or to the side of the first anchor. Half the sutures from the first anchor are secured into this socket with another anchor. Prior to putting the anchor all the way down, the sutures are tightened to compress the tear against the bone. This is repeated again just behind the previous anchor. The final result is a fully knotless rotator cuff repair with broad compression across the entire rotator cuff tear. This helps ensure complete healing of the tear.